in the Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq people. This territory is covered by the treaties of peace and friendship, which Mi'kmaq and Wolastoqiyik people first signed with the British Crown in 1725. We also recognize the histories, contributions, and legacies of the African Nova Scotian people who have been here for the last 400 years. So I'll start off with a little bit of a background on what is the strategy for patient-oriented research, or SPOR. We're just one unit of a national strategy for patient-oriented research, which is an initiative of the Canadian Institutes of Health Research. It's about providing evidence needed to inform the development, of health policies and improve the healthcare system. So we're really excited to be able to offer this opportunity under that umbrella. So what is patient-oriented research? And if you have any questions about patient-oriented research or patient engagement during this presentation, Lisa McDougall is on the call, and she is our patient engagement coordinator. And if you have a question that she can answer during the session, and just put it in chat, and then she'll respond to that. Otherwise, we'll wait until the end and take questions at the end. So patient-oriented research recognizes that patients have lived experience of their health conditions and the healthcare system. We also use the acronym POR, values this knowledge and engages patients as partners, connecting them with healthcare providers, decision makers, and others to conduct research that is relevant and applicable to improve healthcare. And so we have guiding principles that patients, and the patient is one of the CIHR words. It doesn't necessarily mean the person living with a condition or having an illness, but those who are involved in care. It can be a family caregiver, it can community. There's lots of different ways to look at that, and we'll explore that in a little bit. Just to give you some more knowledge. They need to be involved in all aspects to ensure questions and results are relevant. Decision makers and clinicians need to be involved throughout the entire research project as much as possible. It requires a multidisciplinary approach. And we use this term quite a bit. Lisa's I think it's one of the top 10 words I hear from you is co-building and co-developing. And that's really important that we work together on that initiative. So first things to do, what to ask yourself. Are patient partners on your research team in some way, and are they engaged? And all levels and all stages is awesome, but I know that's not always possible. So that's why you'll give a plan of how you are engaging them. Do they have they identified that the proposed research is actually important? Is it important to them? Are there decision-making processes where they can help with co-building? Will they be engaged in selecting the outcomes and choosing how they will be measured? And are they engaged in sharing the research? So those are a few questions that you can ask yourself to ensure, is my project patient-oriented, and does it then therefore qualify? And I apologize for turning around. The keyboard's over here. And I can't use it. So a little bit about the training program itself. It is, the purpose of it is to support research trainees to develop capacity for understanding research that both meaningfully engages patients and addresses their priorities. So that's really what we want to do is build capacity in this area. So some of the requirements, and I'm sure all of you have been looking at these on the website, so you're probably quite familiar with them. So projects need to be relevant and POR in basis. They have to address a health research priority in the province in which you attend university. And those are listed in the program guide, the last section. And I'm not going to list them all, but if you do not clearly state that in the text box, and I've got a picture there of the health priority, if you do not clearly state that, then you will be disqualified. So just letting you know. And you can put in, like for Nova Scotia, you could put in, there's 4 of them, so you could write it out, and maybe you can add a little tiny bit of how. And for New Brunswick, I know it's just one word, but you can add a little bit to that. But it's helpful if you put the number in, because the initial screeners, that's what we're looking for. So that's kind of important, that there is an impact or relevance to the patient population, and then that you can show how you will measure objectives or outcomes, sorry, that matter to patients. We've had a few changes this year. So the letter of support is optional, and ideally it would come from not from your supervisor, but rather if you are working with a patient partner or working with a community organization, they can provide a letter of support. Those are shared with the reviewers, but any other letters that come in from a supervisor or something are not shared. We keep that internal. You do not need to provide us with transcripts. If you're accepted into university, then they have the transcripts, and we don't need to double check on that. There's a CV format that we want. It's listed on the website, and on this slide, you can see that little additional resources piece and the resume format document, and that will download. You click on that and it'll download. We want them consistent. It makes it easier for our reviewers. And again, if you don't use that format, then you will be disqualified. And of course, taking your CIHR, IMHA training, and you can get just one certificate that shows that you've completed the full course. Somebody already submitted and they couldn't get that, so they just provided the 4, they combined them into one document for us. So that comes in, and there's a place on your application on the website to upload that certificate. We've added a generative AI statement this year, and fortunately, the Tri-Council was just very timely in creating some guidelines for this. And so the big important thing is to remember that you are required to disclose if and how generative AI was used in the preparation. And I'll be working with the reviewers to ensure that there is no bias on the scoring process. If it is used, it will still be based on the content and the strength of the project. Remembering that you're responsible to make sure that everything in your application is original work, and including generative AI tools are appropriately cited. And there's a tool on the website under that resources tab where the program is listed that has some how you can use AI, things of how you can use it and what is appropriate to be using. And so those are some guidelines. It's called What is Generative AI? So that is another new thing this year. I think you already know this, but to make it really clear, that you must be supervised by an MSSU scientist. If you were not sure if your supervisor is an MSSU scientist, you can do one of 2 things. You can ask them, or you can go on our website, and there's a space there where you can, I think it's the same, get involved and become a scientist. And there's a whole list of all the scientists. So you can check and confirm that they are an MSSU scientist and that they're engaged in patient-oriented research. You need a patient partner, and then also what's called a healthcare knowledge user. And healthcare knowledge user is defined as an individual who is likely to be able to use the research results to make informed decisions about health policies, programs, or practices. Sometimes there's lots of different ways. You can look into that on the CIHR. There's all of these definitions are in there. And I think they're in the program guide as well. Okay, other requirements. Patient engagement plan. This is past couple of years we've included this, and we want to really have an understanding of how you are going to be engaging them in your project, remembering that patients as partners is not the same as patient subjects. So it's not participants, but it's people who are on the research team. A knowledge translation plan and description of sex and gender considerations in the research proposal. And we also have another subject matter expert with us here today. M is part of our sex and gender science team. He is a previous trainee support program recipient and they are available to answer any questions. And particularly when we get to that section, we made that a big section because we want to make sure people are clear on what we're looking for. So I think everything is on that one page on the website when you go in there, and trainee support program is one of the highlighted items in the top menu bar. It's got your overview or your guide. It's got your application, your self-identification form, how to submit everything, all of your resources. They're all there in one spot. So it's really easy to manage through that. And I'm sure you have already been looking at things, and I've already got self-identification forms. So I know people are starting to get interested in this. So some things about eligibility. You have to be either applied, accepted, or enrolled in a full-time thesis-based master's or doctoral program. So it is important that note it's full-time and master's or doctoral. MSSU scientist, as I've already mentioned, who is involved in a university, college, or institution in New Brunswick or Nova Scotia, and be engaged in research activities that are relevant to patient-oriented research. And we're kind of going through this fast because I want to make sure everybody has time for questions. Funding. We've changed it this year based on some adjustments that we've made with our objective in terms of building capacity. And so we want to build capacity in more people. And so we have changed it so that both levels, master and PhD, are $10,000 for 1 year. You are able to, if you are funded at your master's level, you can still apply to be funded at your PhD level. As long there's two different levels. That was another big discussion we had this year, and we agreed that that would be fine. Okay, engagement and knowledge translation plans. So how you're going to engage your people. I think I've already got that. Oh yeah, there's a link there for knowledge translation plans again on our website on resources. Those things are listed. If you have any questions about doing that, Lisa is probably your best source, as well as our website, and she's certainly able to provide some resources on how to do that. But I think we've been pretty clear in the application what it is that we're looking for, including some way of how you are going to provide appreciation for their work. Okay, now this gets really busy, and this is M's area, and so there's a whole section on the consideration for sex and gender, and I'm not going to read all of that. It's too much to read, but that is all clearly in the program guide and on the application. And there are some tools that are also on our website. And so this is one of the tools that was created a couple of years ago. And it's kind of helps to lead you through it, through the process of how you do it. And then they have this amazing rubric. And if you've been looking at the program guide, you know that we've provided a very detailed rubric this year. And that was inspired by the sex and gender science team. So again, thanks, Em. And so very clearly what it is that we're looking for. So Em, do you want to speak to any of this?
I don't think there's anything super specific in particular, but I think just remembering that often, like the reason that we encourage this, even if you feel like your project doesn't totally have to do with sex or gender, but just thinking about it is a really great exercise for making sure you're covering all your bases, because often the research that ends up being harmful to people of sex or gender minorities isn't research that set out to be harmful, but research that just never thought about how they were affecting these people in the first place. So going through these steps of thinking about how is it related? Is it related? How am I going to ask people these questions? What language am I going to use? Those are all really important parts of making sure that your research is beneficial to people and not harmful.
Great, thank you. So again, those are the areas that we're looking for. The breakdown is, again, we've made some changes. So I know some of you I see some familiar names in the room. So we have made a few changes and put a lot more emphasis on the project description and methodology. So we've increased the weighting of that, and the integration of POR and PE plans. Sorry, patient engagement. The impact knowledge translation plan, why you think we should give you funding, and your considerations for sex and gender. And there's also, I didn't put the rubric in the slides because it's quite a lot, but there's a full rubric which gives you an understanding of how our reviewers are going to be looking at your application and qualifying it. So just to tell you a little bit about what happens. Your applications come into me, so I'm the first set of eyes on them. So I'm the one who will be determining yes or no, we're moving you forward. Yes, yes, you have those things that we required with the CV and with the health priority, and that I can just in a quick scan can kind of move forward. Then it goes to our research coordinator. I think she might be on the Claire. Claire is very involved in this, and she then does all kinds of magic with spreadsheets and putting things together. And so we have an internal review. If between Claire and I, we have some questions around, is this what we're looking for? Does this meet all of our requirements? Then I will either pull in Lisa. I've pulled in our research manager before and said, can you have a look at these and make sure that they meet the qualifications? Once we've gotten to that point, we also send out, I put a call out for MSSU scientists as reviewers, and they complete a conflict of interest and their level of expertise in a topic. So Claire puts together something and sends it out to them, and they say yes, so that we know how to then assign reviewers. So then each application is then reviewed by 2 MSSU scientists. Those are done independently. And they come back in, and Claire again does her magic. And we use a process called normalizing, which then balances everything out. If there are discrepancies that are really large, I usually reach out to the reviewers and try to get an understanding of how that works. We want to make this as fair as possible for everybody. Once we've gotten to that point, then we rate them, from highest to lowest, and determine a number that are then going to go on to our patient public partners. And then they review it and provide their input as well. And again, that's all calculated. And then from there, we take the top scoring ones again, and we go to in-person meetings it's a virtual meeting, but face-to-face meeting, so to speak, with the review committee, which includes the MSSU scientists and the patient partners, and make the decisions as to who's going to be offered funding. So your application has a lot of eyes on it, and so I just wanted you to know that how the transparency of how we do that. Decisions are final. Once the MSSU, and that would be Marina Hamilton, she's our executive director. I share the results with her, and we move ahead. And then for New Brunswick is separate. So that's for Nova Scotia. New Brunswick is separate. They are go or present the results to their provincial steering committee, and then they make their decisions. So, and like I said, I'll be open to questions before we get there. Okay, if you were funded, you would need to participate in the MSSU POR practicum. We also have training in equity, diversity and inclusion, sex and gender, diversity, Indigenous allyship, and engagement. And those are all online courses that we would want our people to take. And any other things that's going on. If we had, last year we had a summit. And so we had a lot of our trainees had posters. We had 3 that actually did presentations, lightning round presentations. And so we encourage people to be involved in that. All of these are free. You don't pay for any of these. So just so you know, and you don't have to be funded in order to take the practicum. We've had a lot of trainees recently coming through who I know are going to be applying. So it's okay. You don't have to. The next session is unfortunately not until April. But once you don't have to be funded in order to attend. Some additional tips. Pay attention to your page length and your font size. This is to give being respectful of the reviewers. It makes it easier for them if they know exactly what they're looking for, and it's a certain number of pages is what they've asked for this year. So keep that in mind. Use lay language. That is something that is very strongly used in patient-oriented research. Making sure that you avoid scientific jargon. If you have acronyms, make sure they're clearly stated what they are. Your application may not be reviewed by an expert in your discipline. It just depends on who we have. I haven't put the call out yet for reviewers, but it's possible that they may not be strongly versed in that. So make it easy for them to understand. Make it easy for me to understand because I'm not a researcher. So, and use the CV format as noted. There is a little video there. It's on our YouTube page. I'll make sure that that gets in. It was a little bit based, it was done last year, but one of the big things, tips, I just watched it, was don't wait till the last minute to prepare your CV. It takes some time. So it's a little bit easier because it is not the Canadian CCV or the Canadian CV, which can get really complicated, but make sure you've given yourself enough time. Don't wait to the last minute, please. Last year, and I say this because last year we had over half of the applications, 38 applications came in on the final Friday. And between noon and 2, it was just like the one after, it was constant. And what happened was that our system was overloaded and there were people who didn't get confirmation emails because there was just so many things happening all at the same time. And I believe it got on the back end, but it didn't get to me. So that's another thing you could be sure of. You get an email confirming that you've submitted. The person who manages our back end after 2 o'clock on the March 21st, I keep a track all day long, all between now and then, of everybody who's applied. And then we compare them and make sure that we've got everything that's come in, that I've had it, and that we have everything for them. So don't wait till the last minute if you can, if that's possible. Your self-ID can be submitted anytime. You don't have to wait until the last day. I'm already getting them. I love it because I can start setting up a file. So that just makes it easier on our end. When you're getting 70 plus applications, it's nice to have a few things organized, but don't rush it either. It's to the point that you feel like may not be doing everything that you need to do. Take your time, but if you can not do it at 2 o'clock on that Friday, that would be a good plan. So Right. Everything has to be submitted by March 21st at 2 p.m. and it closes at 2 p.m. You would not be able to submit anything after that point. If anybody is wanting to send a letter of support that doesn't go through to with your application, that comes to me. So you can provide my email address, which is all over this program. It was not too hard to find. And they can send it directly to me, again, by March 21st. Typically, our award decisions are made early June, and then the funds will be available in September, for your starting year. Whew, I rushed through that. So now I'm going to open it up for questions. So you can either, I'm happy to have you take your mic off, or you can, raise your hand and you can put it in the chat. And come on, I didn't cover it that well. Hi, Jesslyn.
I had a quick question. So, when you were talking about members of the research team, you talked about the patient partner, but you also talked about another like health end user, healthcare end user. So I'm a little bit unclear on that because I do have in the application, there's a column saying other members of your research team, and I have put in the name of a patient partner there, but I don't see another column to mention like a healthcare end user.
If you want, you can put that into your application itself.
Mm-hmm.
Okay, that's one
And
option.
what is
So,
the term like?
sure. Lisa, I'm going to turn that to you. Yes? No?
That's a very good question.
Oh.
That's new to me as well.
Oh, well, what is a
Um,
knowledge user?
is that the question is, what is a knowledge user? I can answer that.
Yeah, so you could.
So I think that knowledge user can be patient partners as well as any other health care providers that you're including in the grant or in your application. So I would say put it there.
Yeah, yeah. Is that helpful?
I think it's really important, like when you're thinking about this, to also include it in places where you're summarizing your project, so that it like the idea of including knowledge users, end users, stakeholders, patient partners, healthcare providers, all of those people who might be interested in the research that you're doing when it's completed, um, showing that you know how you're going to do that and why it's important in the writing part is as important as filling it in a form, to the side. So making sure that that's part of it. I think I would probably sort of tease out your approach to engaging patient partners separate from engaging knowledge users who are healthcare providers, simply because your how you do that should be slightly different.
All
Great.
right. Okay, thank
And
you.
I do want to let you know that our reviewers do not compare masters to PhD. They compare masters to masters, PhD to PhD, knowing that if you're new on your journey, you do not have to put in, if you don't have a patient partner name, then you don't have to provide that, just how you would be engaging them, how you're going to recruit them. I mean, especially if you're just starting off on a project, how have you recruited them, or have you had any input into your research question, by a patient partner? If you have their name, that's great, but if you don't, that's fine, just how you're going to include them. But I want you to know that they're really clear. Masters is against masters, PhD against PhD, because we recognize, especially early ones, early masters are just figuring some of this out, and we want to support you as best we can. One of the things I love about Teams is I know whose hand was up next. And so Isabella.
Oh, yeah.
Hi, Sharon. I don't know if you can see me. Thank you
Yeah.
so much for that presentation. I just have a question about the changes this year with the number of awards that are being given out. I really like that there's been like a change from, I don't know what the number was last year, but down to 10,000 for doctoral and masters to support more students. And I was just wondering how many students you plan to support this year at both levels.
I don't know at both levels. I haven't figured that one out yet. It is, all I can tell you is we will give the maximum that our budget allows. Okay, so if you know the history, you can probably look back and go, typically there's this much, but I can't guarantee what will happen. But yeah, I'm glad to hear that you like that we split that up to support more. Marina and Dan Dutton, who is in Dal in St. John, and as our science lead for capacity development, we really worked on that. We really listened to people and went, what do we want, and managed to make that change. And so I'm glad that works. That's great.
Yeah, thank you. That's wonderful.
Okay, thank you. Zena.
Hi, Sharon. I know we've been in contact over email, and thank you for the great presentation. But so I just have two questions, I guess. My first one is, are there any examples of a uh, like patient engagement plan that, like, any example documentation that you might have, or yeah, because I was looking at the guide and there's nothing on the guide about that, but I was wondering if that even is allowed.
That's a really great question. And I
Yes.
think the challenge, so I'm gonna not answer your question. No. So the challenge is that all research projects are different. And because we're looking at an approach rather than a methodology, we don't really want to prescribe a checklist. So that means that we're asking you as a researcher to be reflexive, to have principles guiding your work of inclusion, co-build, mutual respect and reciprocity, and think about what that means to your project, and think about when you do patient-oriented research practicum, the guidance in there is it's really about best practices. There isn't a here, follow these steps and you've done it. It really is about doing it and kind of thinking about it in a meaningful way, and not all research lends itself well to meaningful patient-oriented research. It is the research that we want to support is the research that's done meaningful and done in a good way. And so I think if you've had an opportunity to do patient-oriented research practicum, or even just the CIHR IMHA modules before you submit your application, I think that's a really good start. But having a good idea of what your research project looks like, and then figuring out, so where's the best place for patient partners to inform this? How do I work with them? And how do you create a project that is flexible for the kinds of decisions that might be made, not by researchers. So that's not the easy answer. And there are lots of resources for different kinds of research. Depending on what kind of research you do, the guidance might be slightly different. And I think that there was a slide that Sharon showed things to think about. And that can help you answer the question as you work through developing your proposal.
Yes, those questions were really helpful.
Yeah.
Thank you, Lisa. I know that wasn't the easy answer, but it was definitely helpful.
There's a few examples of them around if you were to Google, patient engagement plan, and tie it up with a SPORE unit or something. Lisa probably has some examples, but I think that was the good answers there, Lisa.
Yes, thank you.
Yeah.
And then, Sharon, my other question is, I don't know if you got any like updates about if you're taking international student applications or if this scholarship is really only for Canadian citizens.
Well, actually, I had a conversation this afternoon, and that's being moved on tomorrow. So I hopefully will have an answer for tomorrow.
Right. Okay.
Yeah,
Thank you
I
so
see.
much.
Thanks, Marina. Yeah, that's great. Thanks. Sarah.
Hi, I just had a question about student eligibility for students that are in direct entry programs, meaning they're going from a bachelor straight into a PhD without registering in a master's program.
Ooh.
Are those students only eligible for doctoral level funding, or can they also apply once for the master's funding and once for the PhD funding?
If they're going through like the fast track, so they do a year of master's. Is that right, Sarah?
No, this is specifically about the psychology program at the University of
Okay.
Brunswick. They changed their model from a MA PhD to a direct entry PhD.
Okay.
So they
So
are wondering if students would be eligible for master's level funding.
no, not if they're not considered to be enrolled in a master's program.
Okay, great. Thank you.
Okay. Now, and I was saying earlier, for some, like where it's master's fast track to PhD, those are considered two separate things, so that you would be qualified to apply for that. I already let M know that they can do that if they want. What was else? I was thought of something else. Because I see some people on the call that I know I've seen applications for before, so that's great that you're back. One of the things that our reviewers do, which the easier we can make their work for them by making sure their CVs are consistent and everything else is consistent and we keep our lines, is they actually provide written feedback, and that can be provided to you. And I know that I know there's people here that have said, that's been really helpful, and it has been helpful in people actually having their next application has been a more successful application. So yeah, thanks, Isabella. And so, the more we can do to make their life easy, they're busy people, then the more time that they're able to put into providing that feedback. And they want to provide that feedback. Last year, our scientist committee was 18 members. We went from 12 to 18 because of the number of applications. And so they just jumped on and they just did it. And so it's wonderful, but you have the opportunity to ask for that. It's not given automatically. You do have to ask for it, but that would be available after you get your letter. So from New Brunswick folks, it comes from Research New Brunswick. And then from Nova Scotia, it comes from Research Nova Scotia. Those are our administrators of the funding, and then they spread it out to the universities as necessary. If you know of anybody, and Sarah, I don't know that you have anybody at UNB in French, but we do accept French applications. So if you know of that, we accept French applications in French, and we have French bilingual reviewers. I always make sure that we have at least two on our committee, so that we can make sure that people's applications are considered in their first language. Any other questions? I will definitely be putting the recording will go up on the on our YouTube channel, and I have all your email addresses, so I can even send out an email with the link so that you can get directly in there. But it will be there, and it should probably be there tomorrow. The would be my hope. And I see, is there another question in chat? Oh yeah, you're right. Preference for citation. Just use whatever is appropriate for your discipline. So whatever you use for any other of your work, use that. And the only thing is, I think it's laid out in terms of what you use for generative AI. It's what tool and what version. I think if you've done that, and where you've used it, but everything else, I think it's in your discipline for citation. Any other questions in there that I missed? Oh, thanks, Claire. She's even got the spot there for you. Okay. Well, that went fast. I know there's going to be a whole bunch of people watching the recording because there was 50 people who registered, and so it's good. It's a small group for this session, but that's great. Hopefully, I've answered all your questions. And does anybody have anything else they'd like? And thanks for putting that information in, Marina. I appreciate that. I'm sure they do too. You took your mic off. Did you want to say something?
Oh, no.
Okay. Okay. No worries. Well, then I'm going to wrap this up because the sooner I do, if we don't have any more questions, then I can get the recording ready and get it on our YouTube channel as soon as possible. So there's another message down here, and a thank you, Lisa, and thank you, Em, for joining us today. And it's good to see you and have your expertise. So thanks so much, everyone.